When we talk about cancer, it's really an important area because it touches the lives of many people, and it is one of the most high-frequency happening disease globally. And when we started this program, we have had in our mind to put an integrated service where we can have everything under one roof. So patients can come and get an accurate diagnosis, arrive at a management plan within the shortest possible period of time, because these patients usually have an anxiety when they are told that you might have a cancer. So our plan was to put together talents and form a multidisciplinary board of radiation oncologists, medical oncologists, sit together and review the case as a team with all subspecialties needed to arrive at a management plan, to give that to the patients and then advise them this is the best from the evidence that can be done for you, whether it's a surgery, whether it's a radiotherapy, whether it's a chemotherapy, and you can do it anywhere you want. If you want to do it in Zahra, most happy. If you want to do it elsewhere, at least you have a concrete management plan given by the tumor board, which we call it the tumor board actually. And they have been meeting non-stop every Wednesday at 3:30, and the meeting is attended by doctors from the hospital, from outside the hospital, and from the UAE, from the US. We have a virtual connection, so we bring talents and expertise from everywhere. And they review these cases weekly, and I think they are into their 400 or 500 meeting, which is now for us a very big success. And this is actually the secret behind the success of Al-Zahra Cancer Program. It is about the team who work behind it and the multidisciplinary approach towards the cancer, and the patient given a management plan at the end. And that's what the patient wants. He gets all the concentrated opinions and expertise of this group of people in the form of a management plan and advice. I think this is a very good question because Dubai and the UAE are very popular about having a very high-end healthcare facilities, which are very well equipped and very well staffed. What we did differently in Al-Zahra is we opted a strategy of surgical and hospital differentiation, and we started establishing different centers of excellence where you have concentration of expertise so that we can have a center of excellence for demonstrating good patient outcome compared with international benchmark. So we had a center of excellence in orthopedics and sports injuries, a center of excellence in breast cancer, a center of excellence in heart attack and myocardial infarction, acute heart attacks, a center of excellence in bariatrics and obesity surgery, a center of excellence which is very important for minimally invasive surgery, especially in gynecology, where we do advanced laparoscopic surgeries, and a center of excellence that's being planned for thyroid cancer as well. So as you can see, over a short period of time, we have been adding 1 or 2 center of excellence every year, just to make sure that we are providing service at its best, clinically and from a patient outcome perspective as well. So this is what differentiates the hospital. The second thing, which is very important, is the adoption of technology. Because as you know, technology and technological innovations have taken healthcare to the next level everywhere. And when we looked at technology, we looked at it at the different levels, from the patient journey in the diagnosis. For example, our 3 Tesla MRI, which is installed last year, the latest, it's enabled with artificial intelligence. So it can tell us what's the best setup for the patient. Once the patient stays on the table, the machine itself tells us for the best setup for this patient is 1, 2, 3. And then once the scan is done, it tells the different options to arrive at the most accurate diagnosis, working hand in hand with the radiologist. So this is implementation of AI or artificial intelligence in diagnosis. We apply it also in procedures. So for example, our joint center, we do 3D printed knee joints, which are custom made. So it's not a fixed size number 3 or size number 4 knee. No, it is customized to the individual patient. So we take the measure, we scan it, and then we reconstruct the joint according to this particular patient to replace it with the most precise and best outcomes. For cancer surgery, for example, sometimes we need to combine chemotherapy with the surgery itself. A procedure called HIPEC, we use some equipment while doing the surgery. We do infuse the chemotherapy into the abdomen of the patient to get the best results through a heated chemotherapy technology. So this is also a technology that's used in very minimum number of centers across the globe. Al-Zahra is part of it. Another technology which we usually use here is the use of the magnetic rods in spine surgery. We do advanced pediatric spine surgery, a surgery that's rarely done in this part of the world because it takes the children who are having back deformity and scoliosis, takes multiple surgeries. So with this magnetic rod technology, we don't need to do multiple surgeries because we can adjust that rod from outside without having to put another one, remove the older method. Now we can adjust it because it's magnetic. We can, as we move on, we can expand that size. And this is something very unique here. Many of the patients used to travel abroad for this. Now they are not. They are here doing these surgeries here. So this is how we use technology, not only in the diagnosis side, but also on the procedures in order to leverage that and help improving the patient outcomes. I think the COVID time was a very challenging time. It remains a challenge, of course, but during the wave when we had many patients admitted, one of them had a very nice story. She was the first delivery of a COVID-positive mother. She was a COVID-positive mother and she had to do a delivery. And the moment we had this, I mean, it's completely different because it was the first case here in Dubai. And alhamdulillah, luckily the baby was absolutely fine, good. But we had to do some separation for a while. So it is at one point, it's very joyful event delivering during this tough time. And luckily, alhamdulillah, the mother went after some time very good and the baby went very good. So that was a very good experience. The second experience was when we had our first infected staff. We had few staff who had been infected as well due to the exposure. And everyone in the hospital was just, in a very stressed mood. But she herself talked to us, addressed us, and she was a nurse in the ER, in the emergency room, and she was in a very positive mood. So she reflected this positive mood on each and every one of us. Also, the moment we celebrated our last discharged patient from the ICU, because we have turned it into a COVID-free hospital, certified by the Dubai Health Authority, so we don't accept any more COVID patients from June. And the moment we discharged the last COVID patient was a very sentimental moment, and everyone he was a local Emirati gentleman, and he was very much appreciating for the team, and we did a big celebration in this time. It was a very touchy moment for all of us. I hope we don't see this anymore. Now we're COVID-free. We are providing all the measures to maintain the safety of the patients who we serve. People have always been traveling to seek health elsewhere, and I think that will remain, and even that will grow. And if you look at it, I mean, I look at it completely different. If you look at it, someone who's traveling to come to a hospital, he's traveling to be in the safest place possible, because hospitals, they are prepared, equipped, and this team is trained to take the maximum safety measures, unlike anywhere else. So one is, yes, they are safe. Coming to the hospital is very safe. That's number one. Number two, it's about the safety measures that are taken in the hospital by the staff that has to continue, and by the patients that has to continue. No matter if we see that coronavirus hits are less, the numbers are less, the measures should continue. The measures which include distancing, again in the hospital itself, the measures that include repeated hand washing in the hospital itself and for the patients and for their visitors, the measures that include wearing masks and personal protective equipment. These are like a new normal which we live with, and we will continue to live with, but it provides more and more safety. So patients or medical or health tourists coming to a hospital, they are in a very safe place, especially in Al-Zahra, where we apply all these measures stringently and we follow them by heart. So my message is, you are safe in Al-Zahra Hospital, and you are safe in Dubai hospitals in general. We have a great healthcare providers in the region, in Dubai in particular. So I mean, what makes us here very successful is the level of very healthy competition we see here. Not only private hospitals, to be honest, the government and public hospitals are at very high level, and this raises the standard for everyone. So I think the workforce that work in hospitals and healthcare here is very, very lucky and privileged because they raise the bar, which reflects on them and their performance as well. One of the things that we are always looking at constant, it's in our vision, is to be a regional leader in clinical outcomes, which is what is our bread and butter, what we do. We have to lead in that. We have to demonstrate always that we are leading in clinical outcomes, comparing ourselves not only to the local hospitals, but to the international benchmark. And this is where centers of excellence come. and to be a regional leader in patient experience. And this is what also differentiates us. We measure patient experience continuously. We make sure at least that we are not letting this to be a side way or to be a second best. It has to be a first best all the time, because patients are coming expecting to have good outcome, but also they have expectations in terms of experience. The whole journey of the patient from the moment they start to approach the hospital at any touch point, whether in the call center, whether on the website, whether in the social media, whether even walking to the hospital, until they finish their treatment and go back home and being followed up, the entire experience has to be mapped, has to be well delivered, and has to be assessed and monitored all the time. So these two things, clinical outcomes and patient experience, are major differentiators here we look at in Al-Zahra.